My name is Donnelly Kirk. I work for Brock Community Action. Brock Community Action is a social services organization based in Rutland. We work with people throughout Rutland County. But that's not why I'm here. You're not here to see me. You're not here to hear about me. You're here to hear about the field of veterinary medicine and veterinary technicians. I'm going to show you a quick little video, kind of give you an idea, 15 seconds of what living in Rutland County can be like.
It gives me the option to live and work in a place where I can do all the things that I love. These activities that I used to do maybe once a year, these are all things that are 5 minutes from each other.
Quick, easy, and painless video.
I wish it was a little longer.
Want me to do the long one again?
Nah, it's all right.
I'm going to turn the floor over to Alex. Thank you so much for joining us today.
Hello, I am Alex from Riverside Veterinary Care. I'm not sure if any of you are familiar with our practice or not. I know some kids from the last group had animals seen by us before. We have a practice here in Rutland and also an office down in Ludlow, Vermont as well. I grew up in Mount Holly and actually used Riverside as the veterinarian for my own animals for many years. And then I went to University of Vermont, originally studying veterinary medicine. I had planned to go to veterinary school. By the time I was done with UVM, really crunched the numbers, it was going to be about $400,000 in debt by the time I was done with veterinary school. So I decided not to go that route. Kind of had a brief moment in time where I wasn't sure what I was going to be doing. And then I discovered VTC up in Randolph and their veterinary technology program. And with that, I learned the restraint, the animal skills that I needed to become a technician. And I actually began working at Riverside while going to school at VTC. Being a vet tech, that's one of those jobs where you can actually learn and go to school while having the job. You can do the online learning with it, and with that you actually have the veterinarian that you work for signs off that you've done these procedures, that you've practiced these skills, so you get paid to go to school, which is pretty cool. So that's one thing that if you're coming right out of high school, you can get that job and learn at the same time. And that is kind of what I did. So what I'm going to do is kind of talk a little bit about what a typical day looks like and some typical things I see at the clinic. Anybody have issue with blood or anything? Okay. So I'm going to kind of talk about a typical day. So if I go into work at Riverside, I could walk into a day full of healthy dog appointments where I'm going to give vaccines, talk to owners about preventative care, give out flea and tick medication. Or I could have a healthy dog walk through the door, run some blood work, and find out it has kidney disease, or find out that it has another major problem. And that healthy appointment could then go on to really in-depth things. So like this cat here, this one actually had a wound that extended from its sternum all the way down both back legs. And this was after weeks of bandage changes that we had actually gotten this cat's skin to grow back together. And like in this photo, this is a bandage that was literally like a little kitty diaper. And it's kind of hard to see here, but this is still open wound. There's no skin there yet. And then like this could be a healthy dog appointment. You would go in and you would draw blood. And this is what we call a 40X or a SNAP test. This tests for 4 different diseases. One of them is heartworm, which is a pretty dangerous disease that's spread by mosquitoes. It actually creates worms to live inside the dog's heart. And that is tested for along with Lyme disease Anaplasma, and Ehrlichia. Those 3 are pretty serious tick-borne diseases, all of which people can get as well. People can get heartworm, but it doesn't go to our heart. It would just, sometimes it actually goes to your eyeball. Imagine, yeah, strange things in the animal world. So this dog here came in healthy. We drew the blood work for this test, and it has 2 serious diseases. Both of these can end up being fatal. Lyme disease can cause kidney failure, and Ehrlichia can cause fever, malaise, and your red blood cells and white blood cells damage to those. But if we hadn't run this test, properly, we wouldn't know that this dog had these diseases. And this is a job of a technician or an assistant. You go into a room, you draw the blood on this animal, you properly run this test. So it's your responsibility to make sure that these things are getting done. And like an x-ray, this is an x-ray we took. And with this you have to get the correct settings for the x-ray, correct positioning for the x-ray, label your x-rays appropriately, and then the doctor looks at your x-rays. But everything up until that point is all your responsibility. And this dog here, these are all shotgun pellets covering this dog. And that's a prior injury. We weren't even x-raying him to look for those. And then this here is a little kitten that got rushed in. It had been bitten by a dog, and its diaphragm had herniated, and its internal organs had been pushed up into where its lungs belong. So then we performed surgery on this little kitten and closed the hole in its diaphragm. And this kitten is the size of your hand. And then 3 o'clock in the morning is always the best time for porcupine quills. So this is another thing that is very common in veterinary medicine. A lot of vet clinics still have on-call hours and night hours. So this was my on-call night. I get the phone call at 3 a.m., there's a quill dog. So I go to the clinic, and what I'm responsible for is I have to draw up the anesthetic drugs for this dog, calculate all of that. The doctor does check it, but it's my responsibility, and then I draw it up. We inject the dog, remove all the quills, give antibiotics, give pain medications, wake the dog up from anesthesia, and then return it home. And the majority of the hands-on work on a case like this is all done by me. The doctor makes that plan, and then I'm the one that has to follow through with it. And this dog, head to tail, coated in quills. And then another kitten that needed surgery. And then this dog got a bottle ring stuck around its mouth. And things like this are pretty common, where you wish you could take that off, but it requires sedation. You have to anesthetize the animal to be able to remove it. And this is a big, great day, and I'm going to go backwards through these photos. So this is after surgery. You can see this is anesthetic machine and tubes. And then this, if it was still on, if surgery was going, is heart rate monitor, blood pressure, CO2, any parameter that you would be measuring in a human hospital, we are measuring on an animal. And any nursing role in the hospital, that is one person doing all of those jobs. You're gonna go from surgery technician to x-ray, to laboratory, to restraint, to cleaning up after the animals, to checking a patient out, doing the cash register, all in the span of an hour. You really don't have just one job. You do everything. And this dog, underwear. It ate its owner's underwear. And we had to run what we call running the bowels, where you have to check every bit of intestines to make sure that they are healthy. And in this surgery, I was the one holding the abdominal cavity open for most of the surgery. Your arms get pretty tired. And then again, more procedures. And then this was a dog that came in that had an autoimmune disorder that actually causes it to react to its own skin. So it's calling its skin a foreign body. And with that, we're actually using silver sulfidine cream and honey to help heal those wounds. The antibiotic properties of the honey are going to help heal that. And after the skin comes off, you can see how this nice, healthy pink tissue is growing back. And he looks much better. And then this dog is one where the owners had gotten their dog spayed, which is to remove her uterus and ovaries at their vet in Connecticut, and came to Vermont for the weekend and left their beautiful dog in its crate while they went skiing, and she decided to chew out her sutures. And then the sutures opened right up into her abdominal cavity, and her intestines were actually hanging out of her body when she arrived at the clinic. And since she is a dog, dogs like to chew things. So she was thinking that she should chew on her intestines, but we did not let her do that. She recovered just fine. We repaired her and sent her on her way. But that's the type of thing you're going in for a normal day, someone calls to say their dog's incision is open. You don't know what to expect until they walk through the door. And that's not the only instance of intestines on the outside that I have seen. It's a lot of fun too, downtime, try to do some enjoyable things, but it's a stressful job. There's a lot of times when you really have to look at an animal and do what the owners want, even if it's not what you would personally do. Because they're not your animal. You're helping owners and veterinarians make decisions for animals. And you have to do what you're told. And that can be a hard job sometimes. I helped keep a dog alive all day long so we could euthanize it later on in the day. Not a fun part of my job. That if it was that dog's time, I'd rather it be that dog's time at 8 o'clock and not at 5 p.m. But that's what you have to do some days, because that's the owner's decision. Let's see. And then you do get cute kittens every once in a while. And then if you need to take your kid to work, sometimes veterinary medicine is a good place to have to do that. Because I work at a great location where I can. Anger cats, another big part of veterinary medicine. I've been bitten multiple times, scratched multiple times, have body fluids from animals on me that I'm not sure where they came from me. Like there's stuff on your face. You don't know where it came from. That's a big part of veterinary medicine. If you like to be clean, wear nice clothes to work, probably not the best field, but there's a lot of enjoyment in it. I really enjoy making a difference in these animals' lives and in the lives of their owners and making like great connections. Like I love this cat. He comes in twice a year and he's just so cute. And here's a cat that we helped take care of after it got hit by a car. And this is where the technician's role is really important. Because this is a cat that we were monitoring and keeping an eye on every hour or two, depending on the doctor's instructions. And we had to make sure that it's improving. So we have to keep an eye on its heart rate, its respiratory rate, its temperature. Is it eating? How is it moving? Does it look better than the last time, worse than the last time? Because it's the technician and the assistant's job to be monitoring that. It's not the doctor who comes in every 2 hours, it's you. And if you notice a problem, you have to alert the doctor. Because every time an animal walks in, that's your one chance to make that moment count for that animal. You don't get to redo your surgery tomorrow if you mess up. You don't get to redraw those drugs if you gave an animal the wrong amount. You only have that one chance. And if you miss something on their physical exam, or you move a decimal point, maybe that animal needed 0.01 milligrams of something, and you give it 0.1. Doesn't seem like that much of a difference. Could be a deadly dose. That little bit of a difference in any medical field matters, and especially true here. We don't have as many technological supports as a lot of the hospitals and nursing do. We're still a little bit more behind the times in veterinary medicine. We don't have an omni-cell. We don't have these technologies making sure that I've done my job. It's my responsibility to go and mark off on these forms that I've done my job. Let me find one for you. Here we go. Like this patient here, you can see this form here in the background. These little yellow lines, this dog only has a little bit of treatment, but each of these spots could be a treatment this animal needs to receive. And it could be every hour, every 2 hours. But it's the technician who's responsible for doing that. Or animals who have testing done. Blood sometimes has to be drawn every 2 hours on the 2 hours. And if you mess that up and you don't draw that blood, that whole test has to be rerun the next day. Because you can't do it if you miss certain things. The glucose curves on animals who are diabetic. That's another thing where an animal will stay with us all day long. And we have to do exactly the right protocol or the whole entire thing is ruined. So that's kind of one of the big takeaways from this, is that it's important to be on your game every single day. Because if you do mess something up, it's important to be able to acknowledge your mistake. If you make a mistake in this field, you have to come right out and say, I screwed up and gave them the wrong amount. Because then there's usually something to be done about it. But you can't go in and make a mistake and just expect that it won't have an impact. Because it truly does. Let's see. Anyone see any photos they want to explain? Because I know the last group. Oh, well, did I tell you about abscesses? So this is something that's pretty common in the veterinary world. Our wound abscesses, animals will get bitten by another animal or injured, and what actually happens is underneath the skin, it'll fill up with pus and fluid. So like a giant zit underneath the skin. And we have to clean these out, place drains, and again, treat the animal. So there's a lot involved with something pretty simple sounding. Let's see. And right now, if you are interested in veterinary medicine, a lot of clinics love volunteers or have younger people, like we have a 17-year-old working in our kennel staff right now. There's a lot of opportunities to get into a clinic and help. Because I think it's very important to really go and experience it for yourself. Because it's a lot of ups and downs and a lot of stress. But a lot of enjoyment too, and a lot of cute cats and ties, and dogs and jackets. And you really meet patients. For this patient I've been dealing with for a couple of years now. He comes in all the time. I go to his house sometimes and help his owner give medication. You really build relationships with people and then their animals. Because without that owner having the trust in you, they're not going to let you do what needs to be done to their animal. Because it's a scary, stressful situation that costs money. And they're not going to just throw money where they're not sure what it's going to be. And like this is little Marla. A dog bit her on the head and its tooth went right behind her eye, so her eyeball popped out. And then we actually sewed her eyelid shut, and then she's got this cute little mask so that her eye stays protected. And then just that simple wounds. So incredibly difficult to deal with because dogs don't leave things alone. Bandage changes for simple things like that can be some of the most stressful because he just did not want that to happen. And this dog here, that's actually a fish hook that went in and it luckily missed her actual orb of her eye and just went in through the skin. And we were able to cut this barb off and pull the hook back out. And since she was such a good dog, she let us do that wide awake. And golden retrievers love to bleed. This was a small laceration that this dog managed to get blood every part of the clinic. But you do get to see cute little cat faces like that. I think that's pretty cute. You have to think that pretty much any animal is cute to work in veterinary medicine. Because that'll be one of the few things that keeps you going some days. And like overnight care. Like this was my bed that night. And this is a dog that I am monitoring all night long. And if I sleep through my alarm and that dog misses its medication, that dog could die. And I'm there by myself. It is 100% my responsibility. There's nobody else there making sure I do it. And that's a lot of how it is with veterinary medicine. You're told, this is your job, go do it. And nobody is there making sure you do it. Because they figure you want this job, you want to be here, that you're going to do it. And if you need help, you can absolutely ask, but nobody's going to follow you around and make sure you fed that dog or gave that pill. It's all personal responsibility, which I really like. I like being trusted with that type of work. Older dog, had to have a growth removed without, this dog could not handle anesthesia. This is actually my ancient dog. So we had to use local anesthetic and remove her growth. And then up and ready to go. And we're a small group, and I feel like you guys have some thoughts. Does anyone have any sort of question, comment? Because it's just me presenting today, so I figured we could see a little bit of these pictures and kind of thoughts. I know the last group kind of wondered what one of my most difficult kind of procedures or patients was, and that recently I had one where the owners were not able to euthanize and I had to keep that dog alive all day, and that's pretty stressful. Or when I go to house calls and the owners are very distraught, like we have to do a euthanasia. I'm not sure if anyone is familiar with that term. Putting a dog to sleep would be a euthanasia, and we do those on a fairly regular basis. And those can be hard, but it's also hard when to see animals suffer. So sometimes I feel euthanasia is a better option. Now, let's see. This is a cat that had to have fluid removed from its chest. So that actually came out of its chest around its lungs. Yes,
Can I ask a question about like my actual dog?
you sure can. I don't know if I'll be able to answer it, but
Okay. Well, give it a try.
all right.
So is it like possible to get like brain damage if like a dog somehow gets into some marijuana?
It sure is.
And how would you like be able to tell?
More than likely, when an animal gets into a foreign substance, usually it's kind of a transient state. So it'll affect them for a while. And one like marijuana, we have dogs that get into that and come to the clinic. They are squinting and urinating on themselves and falling over. Those are the classic signs. And that we treat with supportive care, thankfully. Usually it is not toxic. Usually an IV and fluids is what it takes to handle a dog that's gotten into something like that. Anybody else? Yes.
My dogs got hit by a big truck, and we brought them to you. They're both alive. So.
Oh, good.
It was like 2 or 3 years ago.
Was it Candy?
Candy and Charlie?
Oh, Candy and Charlie.
Yeah.
Charlie was better behaved for us
Oh, yeah.
than Candy.
He's always better behaved than me.
Her dog, do you mind if I? So her dogs actually got hit by a car a couple years ago, and I treated them, and the dog Candy had air in her chest, and we actually had to put in a chest tube and pull air out of the actual chest cavity to allow her lungs to inflate. That was
They both get hit at the same time?
They got out of their fence, and they ran in this big white truck like a Dodge, and it hit them, and it drove off too.
and they kind of got drugged, so it was like
Oh.
like the road burn plus collapsed lung. Oh, it was.
And we couldn't like find them, and we had to go around because they were like hiding.
Sure.
So
I remember that vividly. And
Another
that-
thing with an animal that eats marijuana is they have a very hard time regulating their body core temperature. And if they're not treated supportively, their core temperature can actually drop and they can become very shocky. So it's really important to get good veterinary care.
Good point. I did not say make sure you take your dog to a veterinarian if that happens. Yes.
Do you ever work with like large animals or farm animals?
Very rarely. Most farm animal veterinarians don't use technicians, especially around this area, only because the owners are usually good about holding their horse or their cows or whatnot. There are a few large animal practices that do it down in Manchester. I know there's one over New York, New Hampshire, New York, Vermont border. The surgical centers for equine, you have a much better chance of getting a technician job there. But we do work on ducks, geese, a little bit of goats, kind of here and there. Pretty much our established clients that have farm animals, we then deal with them as well. Any other thoughts or questions? I don't think I have any grosser photos than what I've already shown, sorry, but you can find cute kittens like this if you work in veterinary medicine. So, other than that, I feel like that's all I've got for you guys today. Unless there are any other thoughts, questions, or pictures that anyone wants explained.
Show us that dog.
This one?
If you want to.
This
What's
one?
wrong with that dog?
This dog, we're not sure what was wrong with that dog. That dog had not received much vet care and then was unable to stand, and the owners elected euthanasia.
It looks like a hyena.
It does look like a hyena, and she should have been fully furred. I'm not sure. She was a black furred dog. That's about all I can get for you. And this was a hard one. because this was the only day I met this dog, and I wondered for a long time, was there something else I could have done for this dog? If I had seen it earlier, could we have done something? They didn't bring it in till it was at this state, and we have no idea if they tried other things. And that was a hard decision, but the doctor elected to go ahead and euthanize, because sometimes the philosophy is, if we don't do it, are they going to do it themselves? So sometimes our best option, if it is an animal's time, let's go ahead and euthanize and not leave it in the hands of the owners. Oh yeah, and then this dog ate rat poison. And there's two types, well actually more than two types, but the two main types we deal with, there's the one that causes your blood to thin and not be able to clot, which is what this dog ate. And then there's actually another type that's a neurotoxin that there isn't an antidote for. So if your dog gets into any sort of rat poison, mouse poison, call your vet, because it is an emergency. And that's a cute little puppy. I don't know who that is, but it was cute. And then ferrets, we see ferrets sometimes. Yep, I think that's it.
Thank you. Any other questions? Thank you all so much for coming. Thank you to Alex for presenting for us. It's wonderful. She's been a wealth of knowledge for us today. I hope you've enjoyed your day. I mean, at this point, you're heading back to school. Sorry. If you haven't already been to the have you been to the financial fair?
Yeah.
So you've done that already? You've gone through your budget? Lunch?